right, so here we're going to look at a SPECT scan evidence of how traumatic brain injury can be treated successfully using multi-watt infrared light. What we're going to be looking at here are right lateral and left lateral views of the brain. And this is a little different way of looking at the brain. This is actually how the patient's data compares to a normal data set. So we took the patient's data of their brain scan showing their injuries, and we did a statistical comparison to a set of patients who have no injuries, no psychiatric diagnoses, no drug use. They're very healthy brains. And what shows up then is everything that shows up as gray is within the statistically normal range. Areas that show up as red are higher than the sort of the plus or minus 2 standard deviation cutoff of normal in the normal population. Areas of green are 2 to 3 standard deviations below that range of normal. Areas of light blue are 3 to 4. Areas of dark blue are 4 to 5 standard deviations below, and areas of 5 are 5 standard deviations or greater below the mean of the normal database. So in other words, what that means is anything that shows up as light green is a little bad. Anything that shows up as light blue is more bad, dark blue is way more bad, and black is really bad. Now, what's the story in this young lady? So this young lady fell out of a pickup truck at freeway speed and experienced brain injury in both temporal lobes and up into the frontal lobe more on the right, as you can see by the green and blue up there. She underwent 30 treatments with multi-watt infrared light over, as you can see, between July of 30th of 2017 and January 30th of 2017 and July of 2017. So in 6 months, she had 30 treatments. She came back and got a SPECT scan a month after her last treatment, and here's the result. All these areas of damage, all these areas of dark blue in the temporal lobes are considerably better. This area that was black here has improved dramatically, so has these areas of dark blue here. And you see how much her brain has returned to normal function. Now, a brain scan's great, but what was she doing? Well, she went from not walking and barely talking to walking and talking. And so there has been not just clinical improvement, but there's neurophysiological improvement in this patient following a course of multi-watt infrared light treatment.